Hi, it's Dr. Barker with Mobile Osteopathy. Today I'm going to be talking to you about intermittent fasting. What is intermittent fasting? You've probably heard the term thrown around. The other term that I like to describe it with is called timed eating or timed fasting. The gist of the diet is that you eat all of your food for the day during a certain specified time period, and that could be 4 hours, 6 hours, or 8 hours, and then the remainder of the day you are eating nothing and just drinking water. There's a lot of health benefits to this, and it's really not that hard to do once you get going. I just came across a great article. It just came out in the June 2018 issue of Cell Metabolism. It was put out by the University of Alabama, Birmingham, and the title of the article is Early Time-Restricted Feeding Improves Insulin Sensitivity, Blood Pressure, and Oxidative Stress, even without weight loss in men with prediabetes. So the reason why this article is so interesting is because typically when you're eating less hours of the day means you're eating less food and less calories. And so you're typically going to lose some weight, and so the benefits of intermittent fasting are well documented, but this article aimed to prove that there were benefits beyond eating less calories and losing weight. And so in this particular article they took two groups, and all the men participating were all pre-diabetic, and in the intermittent fasting group they ate during a 6-hour period, and the non-intermittent fasting group, the control group, they ate the same exact food. And so typically 3 meals and some snacks. They had the same exact meal calendar and beverages that they were drinking. And in the non-intermittent fasting, they ate that over a 12-hour period. So they had the exact same calorie intake, and their weight stayed pretty neutral throughout the 5 weeks, and then they actually had each group switch. And so the group that started out doing the intermittent fasting then moved into the traditional diet or the 12-hour eating period, and the group that was doing the traditional diet switched to the intermittent fasting. In this particular trial, they did the 6 hours early on in the day, so the participants were starting with breakfast and then finishing right around lunchtime or a little bit after lunchtime. The findings of this article found that their weight stayed relatively neutral. It wasn't a significant change between the intermittent fasting and the regular diet group, but what they did find that the intermittent fasting group, they had better glucose control in their bloodstream. Their insulin sensitivity was actually better. The beta cells in their pancreas, which is responsible for creating insulin, actually functioned better. They had less oxidative stress in their body, and their blood pressure control was better. Now, this trial was actually interesting. The most difficult thing for the participants was actually trying to eat that much food in a 6-hour period. And so typically when you're doing the intermittent fasting, you're eating 2 meals and maybe 1 snack over a much less time period than you would typically eat a 3 meals and 1 or 2 snacks in a day. So it's a good article. One limitation is the number of participants was kind of low, but I did like that they took each group and had them do the intermittent fasting for 5 weeks and then switched them to the regular diet for 5 weeks. Overall, some very compelling evidence to try out the intermittent fasting. But what I suggest to my patients and to others is not really to go by what an article says, but to try it out, see how you feel. I've been doing the intermittent fasting for 4 to 5 months now, and I follow an 8-hour eating plan. So I start eating in the morning, and then somewhere between 6 and 8 hours is typically when I'm done eating for the day, and then nothing but water after that. And I feel great. I've lost about 19 pounds. I have less inflammation and less gut complaints, like less bloating or reflux, GERD symptoms. And then I also have less inflammation in my joints, I've even noticed. Prior to starting the intermittent fasting, some days I was waking up with a little bit of swelling in my hands and some achiness, and I haven't had any of that since I've been doing the intermittent fasting diet. I started out doing 7 days a week, and I was eating breakfast and lunch Monday through Friday, and then transitioning to eating lunch and dinner on the weekend so that I could still eat dinner, go out to dinner with my family on the weekend, and have that social interaction during dinner. And now, since I've gotten to my goal weight, I've actually just been doing it during the week, and so I eat breakfast and lunch, sometimes a snack after lunch, and after that I'm done eating for the day. And on the weekends I eat a typical diet as far as breakfast, lunch, and dinner. And I've noticed that even transitioning to being less strict and only doing it 5 days a week, I'm getting the same benefits. My weight has been neutral. I haven't gained any of the weight back, and I still feel great. I just feel a lot healthier. I have a lot more energy. So I really recommend the intermittent fasting for anybody who's trying to decrease the inflammation in the body, trying to treat or prevent diabetes. Definitely speak with a doctor and talk about the best type of regimen for you and what's going to work for you and your body. I hope you enjoyed this segment on intermittent fasting. I'm a big fan of it. I'm going to keep doing it, and thank you very much for watching. Follow my Facebook page, my Instagram and Twitter account for more updates. And if you have any topics that you want to hear a video about, please leave them in the comments below. Thanks for watching.